So thank you so much, ladies and gentlemen, and first of all, thank you, BioCat, and also Preciseu and the government of Catalonia for organizing this, as well to Nicolás González Casares. We are sharing two events today, so it's an intense day in the European Parliament, and honored to do the closing remarks together with a very good friend, for a long time, Kiko Trillas. So I would like to give some insights, but of course I'm sure that he will come with an in-depth view from the Catalan government. But listening the interventions, I think that today has shown us with this workshop what Europe does best, which is bringing together perspective from politics, science, industry, and society to shape our common future. We end up, I think, with a clear understanding that personalized medicine is not only about science and industry, it is about patients and about structures to make innovation possible and accessible. It is about people, their health, their dignity, and their future. And actually, I come right after an event that I organized together with Nicolás on long COVID to find solutions, to listen to patients of this so new and so unknown illness. And I think it's a good example on how at the center of it should stand the patients, and personalized medicine means moving beyond the one-size-all approach towards a more targeted treatments. It means recognizing that each patient is unique and that treatments must be adapted to their specific needs. In many cases, it delivers a treatment when no treatment exists, and this is the case for long COVID, but for many others. And coming from Catalonia myself, and I was together with Nicolás last year to visit to the clinic of Barcelona, he mentioned it, and with the pioneer ARI 001 are perfect examples of how ATMPs can save lives. And Europe needs to ensure that such practices are not exceptions, but a model to build upon. So the Biotech Act and the Pharma Package, two important files that they are undergoing now in the European Parliament together with the institutions, can be decisive in driving the European Union's life science ecosystem to the next level. We need a framework that encourages innovation while ensuring equal access for patients across the EU. That's a huge challenge, of course. And I think that the European Union can be a global leader that sets the standard for ethical and equitable innovation worldwide, because we can see other regions in the world that don't put the affordability or the accessibility at the center of it. So I don't want to enter too much, but of course I want to talk about Catalonia because I come from there. So I think that shows what is possible when regions are empowered and devoted to the research and the innovation, especially. So it's bioregion, it's not only a regional success story, but it's a European asset for other regions to follow, counting with more than 1,500 life science companies employing 220,000 people, contributing with 7.6% of its GDP. We consider that this is a success that combines a good combination, good link between government approach, of course, together with hospitals, universities, research centers, entrepreneurs, industry working together. And I would like to mention that I think this good example should help us in the negotiations we will have with the MFF, with the multi-annual financial framework that we are starting now. You know that it's a huge dossier that we have every 7 years. And so far, the proposal we have by the European Commission reduces the regional control over EU funds. And from my perspective and from the the S&D group perspective, which I represent, it's very worrying and concerning, because weakening the role of the regions, and it was one of the topics that you mentioned today as well, would be a step backwards, because it is at regional, local level where investments turn into therapies and where policies turn into patient outcomes. So also a takeaway from this workshop could be to send a message to these negotiators to really not undermine too much the role of the regions. Finally, I think Europe has a chance to lead the world in personalized medicine, accessible and equitable, but the true leadership will not be measured in global rankings. It will be measured with science solutions that can save lives and the patients saving lives. So thank you, moltes gràcies, and it's an honor to be here. Now, Francesc.
Okay, thank you, Laura, and thanks for the invitation to speak, and congratulations to the organizers for this very important event. I don't want to delay your access to those tempting drinks that I can see there, but I think that it's important to note how remarkable this event is in these times. Okay, so here we are in a kind of alliance between democracy and science, which are both under threat now in the world. Okay, and they can be saved only together. Okay, only science in alliance with democratic institutions, and democratic institutions in alliance with science can be saved together. And it's important to have this event here in this Altiero Spinelli building. Altiero Spinelli is one of the founders of the European idea, who devised, together with others, the Ventotene Manifesto when he was arrested by the fascists in an island at the end of the Second World War. So it's remarkable that today we have this event here, which is more significant than in other times. Okay? And I think that we are doing something really, really important. This event is a good example of the need to highlight the work that is done at the European level with European funds and with the participation of different levels of government, including the regions, to promote research in aspects that directly improve the quality of life of people. The Precise EU, or Precise EU project, led by BioCat or BioCat, okay, from Catalonia, is a very good example of the role of regions in improving innovation and productivity to recover the technological gap between Europe and the United States that was identified by the Draghi report. Regional governments certainly have information and contact with the productive and research reality on the ground. For example, there was a very interesting question before. For example, through public research centers and public hospitals, which in Spain are the responsibility of the regions, like Catalonia. So we have important responsibilities. We have access to these institutions on the ground, and that makes us fundamental, regional governments and regional institutions, fundamental to identify opportunities and get the most out of the collaboration between the public and private sectors, like BioCat, bringing out the best of both sectors. Sub-state entities like Catalonia and other regions are very well placed to benefit from the competitiveness fund. There's no contradiction. That is foreseen in the new multi-annual financial framework. That is why our government, like other regional governments and their platforms, calls for the active participation of regional governments in the design and management of European funds. And at the same level, at the same time, we offer ourselves as the main allies of the Commission and Parliament in strengthening and modernizing their budgetary mechanisms, which have to be strengthened and modernized. This is the spirit of the economic strategy of the government of Catalonia, which is written in our plan Catalonia Leads for Shared Prosperity, which aspires to make Catalonia the best place to live, work and invest, and to do so by placing itself at the forefront of the implementation of the Draghi report and the so-called competitiveness policies of the European Commission to strengthen policy integration and close the technological gap with the United States. As the US economist Paul Krugman wrote just last weekend, Europe's economic pessimism is not justified. In many aspects of well-being, precisely, Europe is above the United States. For example, in life expectancy and public health systems. Life expectancy is important for economic welfare, because presumably not being dead is an important part of quality life. But it is true that we have fallen behind in some cutting-edge technologies, as Krugman explains. To make up for the disadvantage, first, Europe needs to create a true single market as proposed by the latter report. Second, Europe needs to develop a continental R&D strategy, as has been suggested here. The Draghi report notes that public spending on R&D is comparable between the US and the US, but European spending is mostly carried out by national governments, rather than by the EU at the federal level. At the very least, much more can be done to coordinate it, and projects like Concise EU are a step in the right direction. Finally, the Trump administration's destructive attacks on universities, science and technology offer Europe a once-in-a-generation opportunity. Many Americans working at the cutting edge of technology would be very receptive if given the chance to move to societies that value their work. Europe could probably recruit not only individual talents, but entire technology clusters, as suggested by Krugman. Imagine if Europe was able to hire the entire staff of the National Institutes of Health. In short, the European economy is performing much better in some welfare dimensions than some critics would have you to believe. But it is falling behind, that's true, in international technological competition. Europe can and must do better. Progress in health, through public policies in general and European public policies in particular, remember, the COVID-19 vaccines is the way forward, supported by projects financed by the cohesion funds and the next generation funds. We must make a joint effort to align regional policies with the objectives of the European institutions. Personalized medicine and advanced therapies projects like lead by example. More biocats, and more preciseus are the future of Europe. Thank you very much.